I'm thinking about having reduction surgery for lipedema, but I'm not for sure if it's the right choice. What are your best suggestions? My name is Katie. I'm an occupational therapist and a lymphedema specialist, and I work a lot with people who have lipedema, not only in the clinic, but also virtually online. And this is a common topic that comes up when I'm working with people who have lipedema, especially in the conservative setting where they're thinking about having surgery, but they're unsure if it's the right choice for them. So here are a few suggestions to think about to maybe try to help you figure out if having reduction surgery is the right choice for you. So let's start with that, is that just because a lot of people do have reduction surgery, it's not necessarily the right choice for everyone, let alone it might not be the right time. So even though if you put some thought into it and you kind of think about some different things that we're going to bring up in this video, and you say, okay, it's not the right time for me right now, it doesn't mean that it's never going to be the right time. Having reduction surgery for lipedema is a big commitment. It's a big commitment financially, emotionally, and physically. So there's definitely a lot to consider before going into having the reduction surgery, and usually it's multiple surgeries. So here are what questions I tell my patients or ask my patients so that they can help kind of problem solve and really think about a few things that could help them determine if it's the right thing or time to do. So number one is surgeons. So there are more and more surgeons, luckily, that are doing reduction surgeries, not only in the United States, but throughout the whole world. So when you're thinking about having reduction surgery, you may look at a few surgeons and just start to kind of, look at their website, their social medias, pictures of the patients that they've worked with. And that can kind of guide you on maybe which surgeon would be a right fit for you. When looking at their pictures of patients, you really want to look at the stage of the patient and look at a stage that's comparable to you. A stage 1 recovery is not going to look like the same as a stage 3. And obviously that's just because there's more lipedema tissue to remove. There's possibly been that diseased tissue in the body for longer. So it's not always apples to apples. When also looking at a surgeon, you want to look at, what guidelines they follow. Are they a cosmetic surgeon? Are they a vein surgeon? What's their background? Are they accredited? So starting to look at surgeons, you may find, okay, I can mesh with this surgeon. I agree with what they're doing. I think that their outcome with their patients have been good. So starting there is a good point. Start. Number 2 is going into reduction surgery, having the right mindset. So when somebody has reduction surgery, it does not mean that they are healed from lipedema and that they no longer have it. Typically, a lot of patients still have to do conservative treatment for lipedema after reduction surgery. They may not have to do it to the extent they were doing before surgery though. So maybe before surgery, they were wearing compression 24/7, having to do a lot of manual lymph drainage, softening tissue, and other tools that people do for lipedema. After surgery, maybe they wear compression just at night or maybe just as needed. Still really working on keeping the diet or eating lifestyle that works best for their body, still exercising, maybe doing some different tools that they enjoy and that work well for their body, such as using a vibration plate, doing cupping, things like that. Another thing to think about when doing or thinking about having reduction surgery for lipedema is, do you have the support to go through a surgery or surgeries? It takes a lot of care to get through those surgeries. Depends on how far you travel, of course. You may be fortunate where you click with a surgeon that's in your area, but a lot of patients are traveling for these surgeries. And the travel home can be very physically exhausting and difficult. So they need somebody to help them with the wheelchair, get on and off the plane, to help them with their compression garments, things like that. Not only that, but recovery. Usually, the recovery is a little bit more difficult the first week or two, to where they'll need somebody to help them, with their maybe drains, or putting on their bandages, taking care of their bruising and wounds. So it depends on if you have that support. If you feel like you have that support, whether it be from family, friends, or you're able to help or to hire somebody to help you, then that puts you in a better spot to have surgery. Because in my opinion, it would be very hard to go through these surgeries alone. Not only, it's going to be difficult to drive to appointments, but like I said, with wound care, that can be difficult. With pain, putting on your compression garments, you're going to want somebody there with you to make sure that you're safe and to give you the help that you need. Another thing to think about when having reduction surgery is, how much are you looking to improve your quality of life? As a lymphedema specialist, this is a big part of what I talk to my patients about. Is I might not be able to help you change the appearance of your body, but can you go up and down steps? Can you walk, through the zoo with your kids? Can you go on field trips with your kids? Can you play with your grandkids? And if your quality of life is getting more and more affected by lipedema, this is definitely something to think about having reduction surgery. Reduction surgery can help take off that diseased tissue to improve not only your walking, getting up and down from a chair, getting in and out of a bed, but also to where maybe you're not isolating yourself from social situations because you're worried about how lipedema is going to affect you. There's nothing, I think, mentally harder than saying no to a social event, whether it be with family or friends, because you don't know, is there going to be a chair for the distance that you're going to have to walk? What's the heat going to be like? Are you going to swell? What is your pain like? So quality of life, again, for a lymphedema specialist, occupational therapist, is a big factor with having reduction surgery. If lipedema is starting to take over your quality of life, it's definitely something to look into. It's also something that I recommend you talk to your lymphatic specialist or medical team if they feel that's a good choice for you. Of course, if you get to the point where you could be a stage 1, but you don't want it to progress any further, that's a great reason to have reduction surgery as well. Is, okay, I'm in a good spot now, I just don't want it to progress because maybe I'm planning on having kids, and that has been shown to increase lipedema progression. Or I know I'm getting ready to go into menopause. Again, another hormonal event that can affect females. So both ways to look at it, but when we look at, quality of life, that's a very individualized decision to make. And, a lymphedema specialist, a surgeon, your medical team that is familiar with lipedema, hopefully they can help you kind of, talk through that and listen to your concerns. So having reduction surgery is a big decision. It's definitely some to put a lot of time into, as well as, do a lot of research. Look at surgeons, their protocols, their philosophies, as well as take a good look of where you are with your personal life and quality of life, as well as, your support system. These surgeries can be difficult to get through, and having people to help you, having people, whether that be paid or family or friends, it's really needed to get through at least the first week or two after surgeries until you can start to become more independent. So if you are looking for a therapist to work with online, I do coaching for lipedema surgeries and just lipedema conservative therapy. I also have developed a digital online course, and it teaches everything that I teach my patients in the clinic, from manual lymph drainage, cupping, how to soften tissue, how to do compression bandaging, fit yourself for compression garments, exercise. It is all there. So lipedema can be a very isolating diagnosis, and it can be very emotional when you don't have a medical team locally to help you. So just know that I'm here virtually if you need me or want me, as well as you can always send me comments through YouTube, Instagram, also through my website. So I hope you found this helpful. If you would like updates on when I post new videos, please subscribe to my channel, and I hope you have a great day.